I'm a plastic surgeon.
And I'm a psychologist who focuses on loving your body.
And the topic we're exploring today is one of the most polarizing issues of our time: body image.
People treat you better when you're hotter.
The data there does support what you were saying. Johns Hopkins has published a lot on this.
As a species wired to belong socially, I don't actually think that if we know on some level we changed ourselves and that's what made us accepted, we at our core are really accepted.
It's not to say that it should be that way, but it just is that way.
I feel concerned if someone's to drop into this conversation, they might say, well, great, like there's no point in fighting this. What's the point?
Today's conversation is not between your average psychologist and plastic surgeon. On one hand, we have Dr. Hilary McBride, one of the most trusted voices in the body image space today. She's written 3 best-selling books on the subject and was praised by the New York Times for her thoughtful, curious, and empathetic approach. On the other hand, we have Dr. Gary Linkov, one of the top plastic surgeons in the country. With over 1 million YouTube subscribers, he's built a reputation not just for surgical skill, but for pulling back the curtain on the ethics and consequences of cosmetic work.
There's no right or wrong. You can love yourself and you can still want to make some changes.
I am so concerned about how easy it is to get Ozempic and their mental health is worsening.
Do you have the people getting facelifts, let's say 20s, 30s? I mean, that's a very new concept.
And there's kind of like an erasure of aging. People are going to start feeling worse and worse about the very normal human things that happen.
And there's some that celebrate the fact that someone's looking, 30 years younger. Even if we can do it, the question is, should we do it?
Is Ozempic or plastic surgery ever a valid solution?
I will always say,
few topics are more complex than the way people view their own appearance. Love yourself was the mantra of the 2010s and early 2020s. We were going to take our power back and give the middle finger to beauty standards. And maybe that was your mentality, but there was always a disconnect because you can't force yourself to love something you hate. And in the words of Nikki Glaser, people treat you better when you're hotter. So like her, something shifted. Ozempic came along, cosmetic procedures became more affordable, and you saw these as opportunities not just to feel better about yourself, but as an investment, a way to improve your dating prospects, to gain an edge in your career, and to survive, maybe even win in the marketplace of bodies. And if you've been paying attention, you've probably noticed we're entering a new era of body image. Millions of people are trying to make sense of the road forward. Do we give in? Do we resist? And if we resist, does it even work anymore? Or does giving in cause more harm than we realize? This is where we believe nuance can save the conversation. And it's why we brought in 2 people who often get positioned on opposite sides of the equation, a psychologist and a plastic surgeon. If you're new to Mighty Pursuit, we help people make sense of the whole person, mind, body, and spirit, not as vague wellness cliches, but as deeply interconnected parts of your everyday experience. Today's conversation zooms in on one of those parts, body image, while also exploring the deeper spiritual implications beneath it. So in this episode, we go into the middle of the mess. We begin by asking what's really happening in this cultural moment and why so many people who once preached body positivity are now turning to surgery and injectables. And then we shift into the deeper questions underneath it all. What are we really chasing? Is it peace? Is it power? Or is it just a permission to be seen? And finally, we ask the most important question of all. How do you make decisions about your body that you won't regret? How do you build a relationship with your appearance that accounts for reality but doesn't get consumed by it? And by the end of this conversation, you'll be one step closer to answering it. So let's begin. So a few weeks ago, Jamila Jamil, she's an actress and kind of body image activist, posted this on social media. She said, the amount of formerly body positive, safe space content creators who are now going full diet culture, before and after photos, eating disorder propaganda is meaning I'm having to unfollow a lot of people because it's bringing up bad feelings in my brain. And so as I was preparing for this conversation, I actually just came across this quote like a couple of weeks ago, and I thought it really captures kind of the moment that we're living in and what we're seeing unfold on social media. And really what I mean by that is like a lot of people tried the kind of body positivity thing or tried to attempt to love their body or their face or their hairline or whatever. And it seems like some people are giving up on that pursuit to look at their body differently or come to peace with terms with their own body. And so now you're getting this kind of tidal wave of reversal of the very people that were telling people, no, you shouldn't get plastic surgery, no, you shouldn't diet or whatever, are now doing the very thing that, they were saying not to do. And so if you look at the numbers, it's kind of staggering. Ozempic, which is a very new drug, $50 billion. And plastic surgery now is an $85 billion a year industry. And so what sticks out to me about those numbers is not just the speed. I mean, it's not just the numbers, but the speed. So like Ozempic didn't even really exist before a few years ago. And then all of a sudden this drug comes out and you start to see like waves of people starting to take it immediately. And then when you zoom in on specific demographics, it becomes more eye-opening. So men now represent 14.5% of the plastic surgery market, which is double just a few years ago. And in 2022, teens had almost 270,000 procedures done in the United States. So that's invasive and non-invasive combined. And so, I think that brings us to this moment and both of your specialties. No one is kind of closer to that tension than you guys are. So with that framing, I kind of wanted to open up like what exactly is happening in your opinion. So Hillary, if you want to start, when you look at this moment, what do you see?
Well, when I look at this moment, what I see is a few things. The first is that like when we look at it from a research perspective, we see that body appreciation and body dissatisfaction can coexist at the same time. We used to think that they were on kind of opposite ends of the same pole, but now we see them as divergent constructs, which means that people can both have body appreciation and body dissatisfaction. They can feel like, oh, I really want to, or I do appreciate or love these parts of my body. And also, maybe I'm holding deeply internally a kind of dissatisfaction about the way that I look and a fear of aging and maybe some sense of shame about the way that my body is. And so when I hear you talk about that, I'm thinking about it through the lens of people perhaps choosing body appreciation or self-love or body positivity or even body neutrality, not because it feels like the body dissatisfaction has gone away, but maybe because it feels like that was actually the best option for the time. And at some point, a new option becomes available and a person says, well, maybe this could fix the thing that's still lingering underneath. Like it's possible for us to say, and maybe even really deeply believe, like, I want to accept my body, but what's kind of in the basement psychologically, so to speak? And is it possible that when new treatments become available, we say, oh, okay, maybe that thing that's been lingering there the whole time, maybe just now it can actually go away.
What about you, Gary? When you look at this moment, what do you see?
I have a lot of things flying through my head. I mean, you told me, Matt, to bring some stories, so I'm going to tell you a story from yesterday. And this interaction kind of frustrated me a little bit. I'll tell you what I'm talking about here. So this was a patient. This was a virtual consultation with a 21-year-old gentleman, and his mom was on the phone. And this young man, he came to my office, and he actually met with one of my MAs for like it's a tricho scan, just to get a sense of like the hair caliber and like the different kind of portions of his scalp, and like was there thinning, was there nothing? So I looked at the report, and definitely there were signs of androgenetic loss, and in his photos and all that. So he lives here. His mother, I think, was in St. Louis, and turns out that she's actually an oncologist who also told me that she had some of her own hair loss problems after she had chemo. So she revealed all that during the consultation. But what frustrated me was that like he clearly was coming to us for advice on his hair loss and what to do about it. And she didn't seem to think that he needed any sort of intervention, any medications, nothing. And she seemed very kind of anti the whole, request for help from him. And he kind of just stayed quiet the whole consultation. She was doing all the talking. And then at one point, I just felt like she was like pressing me, and at one point she's like, well, if you're 21 and you were losing your hair, like, what would you do? And I just, kind of threw it back and I said, like, I have no comment on that. Like, this isn't about me. This is about your son and him wanting to potentially, at least you stall the loss of his hair or maybe improve it. And if you don't like that he's interested in that, you can talk to him about that. That's that's not kind of leave me sort of out of that discussion between the two of you. But that's how that conversation went. And it was sort of uncomfortable. But at the end of the day, I guess where I'm going with this is that it's a very personal decision. There's no right or wrong. Like a 21-year-old with some signs of crown loss can just live a happy life and doesn't need to be bothered by it. But some people are bothered by it, and it's okay to look for ways to potentially improve it safely as possible. But those ways to improve it have like real drawbacks, and potential for side effects and all these things. And one needs to kind of decide like what matters more to them, and if they're willing to take on those potential downsides. And it comes down to that individual. It's not about what me as the doctor thinks, about what I would do for myself. It's not truly about what his mom thinks, that he should do. It's about like a person kind of stepping into their own shoes and deciding for themselves, like what truly matters for them, and making an informed decision. But these are complex decisions, and I think Hillary brought up like the nuance of it all. And I think that it's a complex decision. You can love yourself and you can still want to make some changes or be afraid of further, whatever it is, for the aging process, changing elements of your face or your body, or, whatever is happening to a physical appearance, or the kind of the fear of something changing. So yeah, it's complex for sure. And I think too often we simplify it down. One
of the boldest things you said on when we had our solo episode before this was that you think that 90% of the population would get some sort of cosmetic surgery if money was not a factor. Would you still stand by that?
I mean, at some point in their life, yeah, I do think so. I think you have a lot of people who are bothered by a changing appearance or their initial appearance, that they were just kind of born with. And I think it's not just money. I think it's like also risk elements, and I think if you're able to lower the risk enough for someone where it starts to make some sense, because if things aren't done properly, or if things are, if the sterility is not maintained, like there's lots of things, right? Like if the surgical technique isn't right, but if all those things are there, I do think that a large percentage of, I mean, I don't know if I could speak for the world, but like the US population would choose to do something. I mean, even if it's like some lasering for their skin to remove some acne scars. I mean, I'm not talking about invasive plastic surgery only. So I think I do stand by that at some point in their life. I mean, I'm not saying like at age 18, but by the time someone gets older, if they look back and said, oh, like, yeah, maybe I could have gotten that done at that time, if the conditions were perfect. So I think so.
What do you think?
Yeah, I was actually going to say, I hope I can jump in here and say, I actually think I agree with you that that's probably an accurate statistic based on what we see in the research literature about how dissatisfied people are with their bodies in general. If what we're saying, if we're making the leap here to say that dissatisfaction predicts action, and one of the actions a person could take would be some sort of procedure, what we see is that the rates of dissatisfaction are high enough amongst people, and unfortunately climbing based on, even things like Zoom dysphoria. There's been a huge uptick in body dissatisfaction based on people seeing themselves in video calls since the
Zoom,
pandemic. Yeah.
Wow.
And so what we're seeing is that people's rates of body dissatisfaction because of social media use, because of video conferencing software, are increasing. And if the dissatisfaction, at least again, like I'm saying, if we take that leap to suggest that would be the thing that predicts the action around like a procedure or making some sort of change to your body, then I think you're right. And although we might think about this specifically in terms of the angle of like preserving youth or maybe adhering to body image standards or appearance ideals, what we know is that it's complicated to be a body. Like my dad, who would identify as a feminist, who was actually shaped deeply my feminist thought about our relationship with our bodies. He's a scholar and academic as well. The other day he said like, oh, my eye my eye is like sagging over, or my eyelid is sagging over my eye. It's like, kind of irritating. He rides a motorbike. He's like, oh, I wish I could kind of like move this away. That we would consider that to be on some level dissatisfaction. Perhaps it's not to adhere to like the idealized feminine, youthful, sexualized form, but it's still like it's complicated to be a body. And if we're thinking about this just through the lens of individual choice, we miss the larger existential conversation to be had here about like, what does it feel like to be us in age? What does it feel like to constantly be in a comparative dance with what we see and who we used to be? And I don't think we have enough resources besides perhaps the will to change or invasive procedure or non-invasive procedure to think about how do we be with that complexity inside that says like, oh, it's hard to be a body. I think we need way better ways to be with the hard of being a body.
That's really good. Yeah. Yesterday, we were at the Paley Center for media. And I thought it was so interesting because on the second floor, there was an exhibit with the Johnny Carson show. The Tonight Show with Johnny Carson, which obviously Jimmy Fallon runs that show now, but he ran that show for 30 years. And then we walked out, and with my wife, we were talking about this, and it was like, oh, it's so interesting because the way that people looked on the show 30 years ago, it was like completely like people, their hair loss, like the women just looked like, I guess just
look like
normal,
regular women,
regular women. And I'm like, the amount of like manicuring, like dolled up, like stuff, like that was only like 30 years ago. And it was so different. Mm-hmm. And they were going on national television and like weren't really altering their appearance. I mean, especially when you look at even people that were supermodels or what in the 90s, like lips, even like people just naturally had like thinner lips. And so like it feels like a lot of these things are newer. I can't help but think about social media as an accelerant for this conversation. I mean, you can't, that is such a big accelerant. Yeah. And so when I was kind of sitting with this, it really made me think like we don't form our sense of self in a vacuum. And so if plastic surgery and all these procedures and the way that you looked at yourself was limited maybe to I'm watching television, I'm in high school, I'd have these people in front of me. I'm not texting because there's no phones. I don't have social media. The purview that you have is socially is much more limited than go online and be connected to the whole world and have everybody and their mother promoting certain things and promoting certain appearances. And so it seems like we form our sense of self, and I'm really interested in your opinion on this, from the social world. Like that's a big influencer to the way that we see ourselves. And so on Jimmy Fallon Tonight Show earlier this year, Nikki Glaser said, people treat you better when you're hotter. It's just a fact. It's a sad fact of life. And she said that she's getting a facelift in August 2026 and called it a wise investment. What is your thoughts on that sort of mentality to look at plastic surgery now or Ozempic as an investment? I'm going to get ahead in the social world. I'm going to have more favorable job prospects. I mean, it seems like there's been 70 plus studies. Some of them are meta-analysis of this actually being true. The fact that, and
Johns
people are
Hopkins
noticing,
has a bunch of them.
Yeah, and people are noticing the fact that they get treated better, or people that look a certain way get treated better. So I want to see what your perspective is on that mentality.
I want to speak about it from lived experience before I talk about it from theory, which is having lived with an eating disorder. I don't currently have an eating disorder, but for a number of years, probably close to 15, I had an eating disorder, which ended up resulting in medical treatment of various degrees, from inpatient to outpatient to maintenance care. I mean, the whole spectrum. And what's funny about an eating disorder, and I really mean it in terms of funny because it's kind of absurd, is that there's, of course, the mental illness component to it. We can look at this as a diagnosable illness and something that requires significant medical intervention and treatment. But as people usually start engaging their eating disorder, particularly when there's a restriction or weight loss component to alter the body, people usually say at first, you look amazing, right? You look great. Not actually knowing that by saying that, they're reinforcing the underlying mechanism that's really fueling the eating disorder. And so my experience was in people commenting on my body in a way that reinforced, valued, praised, valorized, even like, wow, like look at what your body looks like. without understanding themselves, that all of those comments are fueling this cultural narrative and fueling this cultural narrative that becomes an internalized narrative that says, if I change my body to look more like the ideal, then I'm valued socially, then I get desired, then I'm wanted, then I'm seen as more morally superior, particularly when we're looking at, again, eating disorders or body change that sort of reinforces the ideal. So it comes back to this like foundational psychological principle that I think, perhaps is really familiar for me, but maybe not for the general public, which is that our internalized ideals, the things that we say to ourselves about who we need to be, come from somewhere. Mm-hmm. We're not actually born into a body that has a story that goes along with it that I need to be different. We learn that somewhere along the way. And there's a connection between when we actually make those changes and the social reinforcement that we get. It's a very, very powerful thing as a species wired to belong socially, to be safe, to actually preserve our aliveness as a species. We need to know that we are safe and that we belong, which makes us really primed to and attuned to the comments that other people make about what makes us good, what gives us power, what makes us desirable, especially when you add in a gendered layer, which says that women have less power, but the way you can get power is by adapting your body. If you change your body, then you can sort of kind of play the game a little bit. You can get some of that social value back. And maybe if you're devalued, but you can be valued this way, then you can sort of approximate some sort of safety or power. So there's all sorts of factors going into this too. I mean, I didn't mention yet, but it's worth saying that when we look at the tripartite model of body image, essentially, like what are the things that contribute to how I feel and think about my body? We know that peers, media, and parents are the three factors. Like you obviously mentioned media there, but we also have people who are going, oh, I like how you look. And oh, did you see this? And then you already mentioned a story about a parent who was commenting about, what would you do? We have narratives handed to us right from the moment that we're born. In fact, you could say even before we're born about, oh, this kind of body, or you're going to be this, or sexualizing our children in some way that makes us hear right from the very beginning, this is who we need to be in order to be good. This is who we need to be in order to belong. And then when we do those things, then people reinforce that. It starts to feel true. It starts to become the reality that we live inside.
Yeah. No, I mean, even the power of digital media and social media and that, the sheer power of post a photo, 1,000 comments, oh my God, you're so hot. Oh my God, you look so good. You look so good. You look so good. I mean, that didn't exist. That was impossible 30 years ago.
Yeah.
But so much of that, like those posts, that picture, I mean, what percentage of these pictures are altered in some way, with Photoshop, with all types of things. And now it's like we get these images that are completely AI. Like it's not even a real person, it's a bot. And you have people who are being influenced by these kind of fake computer generated images. And they're like, oh, I need to look like that. And that's really dangerous, So that's a big problem. But going back to your question, Matt, with at least like in terms of the literature on perceived attractiveness after, like, let's say, plastic surgery, Lisa Ishii at Johns Hopkins has published a lot on this and looking at like everything from hair transplant to facelift to rhinoplasty. And like they show these images to people like pre-op, post-op, to like random people who, don't even know if a procedure happened. And they consistently will point to the post-op image as making someone look more attractive, more successful. They'll rate them on all these metrics. So yeah, I mean, it definitely, the data there does support what you were saying, that people are viewed with maybe certain work that's done in a certain way as potentially being more attractive and more successful, and other metrics that they looked at. So it does kind of support what at least maybe some people will say, that like, oh, I want to get like Nikki Glaser, like I want to get this done so that I can maybe get more gigs, more like she hosted, right, some sort of award show. So in her mind, and this in some ways, has been validated in more general ways, like maybe it is true that she will be more successful if she gets this facelift. in my heart of hearts wish that was not true. Like, I think, that she should be judged on her merits as a comedian, as an entertainer, and not people overly fixated on her looks. That would be more ideal, I think, but I don't think that that's necessarily reality, So yeah, and this is just something that came to mind, but I think we honestly treat people with like the same sort of underlying issues, we just treat them in different ways, My approach is maybe less talking and more like actionable kind of procedures that with proper patient selection and proper execution lead people to feel better about themselves, has it treated some underlying, way that they view themselves? Maybe, maybe not. I think sometimes it does and sometimes it doesn't. Most of my patients have like very specific asks, if I spot a patient who has like lots of different concerns about their body image and all this stuff, then I think I'm not necessarily the person they should be talking to, and they should probably, have more kind of general advice on the way they view things. But it's a spectrum. It's definitely a spectrum. But also the way I see it is that I think there's like a threshold for each individual of when like something actually bothers them enough for them to like do something about it, whether it's talking to a psychologist, a therapist, or pursuing a procedure. And I think honestly, it's probably 100% of people that at some point, like you mentioned, like with your father's case, like have at least considered like, oh, it would be nice if this was a little bit different. And maybe that's more of a functional thing, in your dad's case, but it can also be viewed as maybe a cosmetic thing. Like for me, now in this bald state, like I have to think about getting sunburned on my scalp. I never thought about that when I had hair. So like, that's annoying. It's not necessarily just cosmetic. There's like a functional like element to that. And like something else, because people ask me all the time in my, on my videos, they're like, oh, what about you? Like, have you had, like, I haven't had plastic surgery, but like my under eyes, the hollowness, like bothers me quite a bit, but it hasn't yet reached the threshold where I'm like, yeah, I'm going to go do surgery because I know the risks. I know the downtime. And maybe there'll come a point where it like reaches that threshold for me. And same thing with hair loss. It just, I can tolerate the change on an emotional level, whereas like a lot of my patients cannot. So, we're all built differently, physically, psychologically, and it's but like you said, it's tough being a body.
Yeah, I think I was just going to mention something here about how like we've at this point in the conversation talked a little bit about media and sort of society but primarily the individual. Like, I think you're right. You and I are both essentially in the business of change. We might approach it different ways, but what we're both experiencing is people coming to us saying, there is something about how it feels to me that I don't like. I think one of the things, or I like it to be different, or I'd like to feel more at ease within myself, which perhaps is the meta conversation here, is why is there so much dis-ease inside of us as people? What is going on for us that there are more people with acute mental health concerns than there ever has before. There's also more people seeking plastic surgery and aesthetic changes to their appearance. What is going on? Like, is this working? Is what we're doing as a society working? And perhaps like the angle that I want to bring in too is that when we make changes to ourselves as an individual, how are we understanding that that is situated in a context of maybe reinforcing an ideal about what a body should look like, or are we changing to become our more authentic self? Like there's another factor here around agency, and there's another factor here around what does it do when we continually change ourselves to look more and more like this one particular image, this one particular way of appearing? Is there something that is missed? And I would argue yes, like in terms of actually having aging bodies that are visible, or diverse bodies, or bodies that look a bunch of different ways, so that we can contribute to an overall narrative of bodies that include difference. Because I'm not imagining people are getting plastic surgery or changing their appearance very often, with the perhaps exception of some like maybe body modification type folks, where we're changing our bodies to look more like ourselves. Often what we're trying to do is change our bodies, or maybe even change our psyche on some level to look more like, or to appear more like a particular kind of slice of image. And so I feel concerned about if someone's to drop into this conversation at this point, they might say, well, great, like there's no point in fighting this. 90% of people want to change their image. What's the point? Like, actually, I think like maybe the thing that hopefully we're going to get to here too is I think that is it possible that this is reaching a fever pitch, and that something really needs to change significantly on a societal level if this many people are dissatisfied, if this many people want to have procedures, if this many people are feeling like the loneliness that they're experiencing as a result of being, on their phone, more connected than ever, but disconnected. Are we at a critical moment in society where it's time for us to say, like, we have to make some significant changes if this many people feel this much distress inside? And if our only options to change things reduce diversity of appearance, right? Reduce diversity of opinions about how life should be lived.
My only thought on that, just like, it's not like a rebuttal. I think I mostly agree with everything you said. But, and I think coming back to the statistics, Matt, that you raised, I think like when you look at desire for weight loss, a desire to change certain elements of our appearance, whether that's with like makeup or something a bit more invasive. I mean, I think those desires have been around for, I don't know, probably thousands of years, is my sense on it. And especially like, when you look back at like the history of like cosmetic plastic, like a lot of it, cosmetic plastic surgery, like a lot of it has to do with the techniques advancing and things becoming a little bit more acceptable. But like people were still getting a lot of things done, 50, 60 years ago, including with like hair restoration. It's just that the techniques were pretty terrible. Like it was like the plugs, and they just didn't look good. But the desire of people to get that work done was very much there. I think people didn't know as much about it. It wasn't available as widely. We didn't have social media blasting it into all of our phones. But like weight loss programs, weight loss drugs, that's been around for a long, long time. Maybe not thousands of years, but in at least the United States over the last 50, 60 years, that's been a very real phenomenon. So I think like the ways that we're maybe addressing those issues or people's perceived issues with those elements have changed, have maybe modernized, have accelerated, have but multiplied. But I think the underlying kind of mindset is still there. I don't think that element of it has changed so much. So I don't know. I don't know if it's something that's like, oh my God, we need to like change society altogether. I think it's like, it's been there, I think. And we need to continue to do better with like how we process all of that. And I agree with you, like, people need to be more accepting of differences and to celebrate differences rather than trying to conform to a certain look. But even like when it comes to specifically like hair restoration, a lot of my patients, and I think again, this is kind of like finding the right fit of, doctor to patient, but most of my patients, like they want to be themselves, just slightly better. Like they're not, like if I have a patient who's in his 50s, 60s, they're not trying to get the hairline of a 16-year-old, there are people like that, but then they don't go to me, and so they're just trying to optimize where they're at now. They're not trying to like turn into a whole new person.
Yeah, it's kind of like hard to ignore some of the research literature too about like what's happening with social media. Like I know that you brought that into the conversation, and when we see like, yes, there have been people who have been dissatisfied with themselves for a long time. I think that that's probably part of the human condition on some level. And you could even say that there's like a growth orientation in that, to be like, oh, I want to do better at work. Like I'm kind of been slacking. I want to do a better job. Like, I don't think that there's something wrong with that impulse inside of us to say like, I'd like to grow. I'd like to organize my life into a way that I feel like I'm flourishing or I'm doing well. And this is really like, I kind of want to avoid getting into the conversation about if a person should have plastic surgery, if a person should change or should not change, and think about like the meta culture that we're in, which is driving us to perceive changing ourselves as being an important and normal thing in order to be okay, to be safe, to be loved, and such that we're losing access to perhaps the place inside of us that maybe does know that we're okay or acceptable or lovable, or perhaps we're losing qualities in our culture where we experience aging and normal aging as a beautiful, sacred, important thing to allow, to revere, to tend to. So we know from, as I was saying before, the research literature about social media use shows that as soon as you get a front-facing camera, like we see these, like very rarely in the history of graphs do we see like a hockey stick inclination in the rates of and instances of certain mental health issues. And what we're seeing is like there's this, in teen mental health, these rates of body dissatisfaction, suicidality, self-harm, eating disorders. We're kind of seeing them like go along, slowly climb. The 90s was not a good time, right? Diet culture, Weight Watchers everywhere, moms taking their teens to Weight Watchers when their bodies were actually totally healthy and fine. And we see like the heroin chic and the Kate Moss, is it Kate Moss? Yeah, moment. And then we see like front-facing cameras on phones, and we see this like absolutely exponential growth in self-hatred. And we see more rates of teen attempted suicides, self-harm, body image, body dysmorphic disorder, eating disorders, depression, anxiety, generalized anxiety, social anxiety. And you have to think about what is happening on a social level when kind of routine social media phone use is normal, and actually the way that teens are connecting with each other. So yes, we can say, well, this has kind of been around forever, but what the data is showing us is that we're kind of at a critical moment about future generations. Like maybe our generations are going to be like kind of okay, right? We're going to have our issues and we'll figure our way through them. Some people will get interventions, some people won't, some people will seek therapy, some people won't. But what I'm thinking about is what happens for the next 30, 40, 50, 100 years. I mean, like what's going to happen when we perceive real faces with our eyes, but they're actually generated images, and we think that becomes the normal thing about how people look. And there's kind of like an erasure of aging. That I think that what's going to happen is that people are going to start feeling worse and worse about the very normal human things that happen as we live lives and have experiences and age, and we have bodies that experience very normal human body things. And I think we have to make some choices and perhaps like think about like how, when I make choices, how do they contribute, or how are they the end result of this social story that we're being told about what is ideal?
You've talked a lot about social power in your work, and I think it's interesting because the advantages of some of these things socially extend far beyond like the dating pool and people commenting on you. For example, I want to get ahead with my career. I want to get ahead with this everything. So if I'm on camera and I'm like, people will pay more attention to me if I look better. Oh, if I have a fuller hairline, if I look better, like people are actually going to pay more attention to what I'm talking about. I just feel like there's so many things people are noticing that extend beyond their own self-image.
Yeah, I mean, in South Korea, like plastic surgery is really, really popular there, and with a very large percentage of the population getting surgery done at an early age, and at least my understanding is that, there's less differences as far like, the base level of education is very high, and you have a lot of people going to, the great universities that they have there, and then they're looking for jobs, and it's harder to stand out because the level is just already very high. So the plastic surgery there is partially being done to just stand out in the workplace, so you can like look different, potentially get that job over somebody else. So, and then when you look at like these K-pop stars, I mean, the men and the women are also like starting to, look very similar to one another. I mean, they're getting these V-line surgery. Like
it's a completely different culture than America too. Yeah.
Yeah. And I think a lot of it does stem from just trying to stand out and to move your career forward, more than just like necessarily like body dissatisfaction, but like this is the image and this is what I need to look closer to be accepted by the population, and maybe even international population if it's like a K-pop star and they're going to be in front of, all these people around the world. Again, I'm not here to say that that's a good thing. I think I don't like that people need to feel that, that they feel that way, that they, are doing that type of work for those reasons. It's tough. Like from my perspective, people come in for consultations and, like, yeah, sometimes I ask them for their reasoning, but sometimes I don't, and sometimes they volunteer it and sometimes they don't. So it's hard to always get to like the bottom of like why you're doing it. And I don't know if everyone is as maybe introspective as we all are here, where they're really thinking through all of this to this degree. I think some people just don't think of it that deeply, and they're just like, oh, it's just something I wanted for a long time, and here I am, getting it done. Sometimes I take it upon myself to think through it for them, especially if there's something underlying that I sense during the consultation that just doesn't sit well with me. Like I say no a lot, because it just doesn't feel right. Like there's just like something else going on that, sometimes they'll volunteer like, oh, my spouse, just passed, and, and they get really emotional and, that they want to do something to change their appearance. And I'm like, this just isn't the right time, just you need to take time, process everything, talk to someone, and then we can revisit this in the future. But, and sometimes they come back and sometimes they don't, and that's from my perspective that's fine. I don't want to, subject someone to something that they might later regret or that they might have a really hard time recovering from, because they're dealing with so much.
You said, I just want to be noticed. There was something about the like, oh, if I can change this about myself, then I'll be noticed, or I'll be seen, or I'll get something. I'll get some sort of attention. I'll get some sort of like, social power. And the psychologist in me is thinking like, oh, what's the thing under the thing always? Like, what is it about being noticed that is going to give us something that we don't have? When did we not feel noticed, that we needed to be noticed? Or what are we hoping will go away inside of ourselves if we be noticed? I think social belonging, as I said before, is such a foundational part of the human experience that we couldn't even exist. Our brains couldn't develop without connection and attention and eye contact and things like that. So we do need to be noticed. But what we know is that people who seek intervention or alteration to their appearance, particularly the more invasive or excessive that it becomes, there is a greater link to childhood trauma. There's a greater link to childhood neglect, emotional neglect, the loss of getting some of the things that we needed early on. Again, am I going to say to someone like, okay, well, you need to build a time machine and go back and get the thing that you never got so that you don't feel this way? But it is important for us to look at that there might be something deeper going on here around even the being noticed. Like, what am I hoping, like I said, what am I hoping I feel, or what am I hoping that I don't have to feel if I get the gaze, the externalized gaze from other people? Will it make me feel less lonely? Will it make me feel like I finally matter, that I'm seen? And are there other ways that we can be seen besides changing our appearance to kind of reinforce a particular ideal? I would say, yeah, there are.
Yeah, what I think, I think that this gets into more, so I think particularly with women, right, when it comes to objectification, I think there's a internalized thing a lot of times perpetuated by men where men objectify women, men make women a sexual object by highlighting their appearance and hyper-focusing on it and the comments that are made. And what's interesting and somewhat controversial is that, and you've talked about self-objectification in your work, which is that I want to be seen, right? So self-objectification would be taking that, internalizing that narrative. And you see this with a lot of like models and things, and not even OnlyFans, where like your body becomes your quote unquote product. And so might resent the fact or even complain about the fact that you've been objectified. But then you'll see some of those same people start objectifying themselves, and that becomes their entire thing.
So objectification theory comes from Fredrickson and Roberts' 1997 paper. So those are the scholars who this theory comes from. And what they said is they defined objectification theory, and the process of objectification is that the body becomes a thing, or the body part becomes a thing through which we compare or maybe then use it to be consumed, particularly for somebody else. So the person of the woman in this situation doesn't exist anymore. It's breasts that can be used or consumed for the pleasure of another person, bought or sold, or we could say the image of breasts or the image of a body. And so self-objectification would be when we begin to fragment off ourself from ourself, right? That I, instead of seeing myself through the lens of subjectivity, as we would call it, like in embodiment theory or phenomenology or philosophy, the subjectivity of the self, we become this thing, and usually parts of things, right? This part of my body. It's amazing just the number of women and men often as well in my practice or in research literature who we hear kind of, they grab a certain part of their body and they're like this, right? Or this part of me we look at with disgust. Like if only for this piece of myself to go away, then I could finally be free and connected to who I really am. And yet who we really are also includes that part of our body. But if we look at objectification theory as well through the lens of, the multiplicity of the self, right? That we have actually, like I think it was Walt Whitman who said I contain multitudes. This idea that there are many parts inside of us. Perhaps there's a part of us that says, I don't like being made into a thing. I feel dehumanized. I feel reduced. I feel small. I feel powerless. I feel like all of a sudden I'm vulnerable to if I'm chosen or not. But then also another part inside of us who deeply wants to be chosen and seen and knows if we play this game, if we do this thing, that maybe I'll get that longing fulfilled, like the thing that I never got in my childhood or in my relationships or in my sports team or in school or whatever it is in my marriage. If I just do this thing, then I'm going to feel okay. And so I think sometimes we have multiple parts inside of us who are experiencing the conflict and tension of the impact of objectification and sexualization. And maybe also a part of us who's saying like, well, if this is how culture is, like, and kind of a defeatist mentality, or maybe like an entrepreneurial attitude to it. Like I can play this game to get the thing that I'm hoping that I'll get back that was actually taken from me in the objectification. The power was taken from me by being objectified, but maybe if I objectify myself, I can get it back.
Do you think there's a hypocrisy in if someone complains about being objectified and then objectifies himself in return?
It sounds like you might have a specific example or person in mind. And so I'm not sure if you do or not, but what I would say is like, I don't really feel comfortable naming what's going on in a particular situation without knowing more of the details of what's going on. But like complexity feels like perhaps something I feel more confident in standing behind, that we actually have multitudes of parts inside of us, including, let's look at it from a different angle. There's parts of us that really, really want to be achieving at work or high achieving, but then also are like, oh, I don't want to get out of bed in the morning. Or, we might have like parts of us as parents who say, I really want my kid to feel so loved and seen. And then, they say something and we are like, oh, I don't have time for that. Like, I don't want to do that. Right. So we're complex as people. We have lots of different things going on. And I think we could look at it in terms of a sequence or developmental progression. Like, did one come before the other? Well, maybe a person was like, oh, I'm powerless in the system. All I can do is get back the power that was taken from me by root that it was taken. Or maybe there's some other explanation, but complexity, contradiction, like developmental tensions. We could even look at it through kind of like dissociation internally, like these psychic splits where I feel the pain, but I also don't know what to do about it. So I'm going to try to do this other seemingly contradictory thing. I mean, we do things like that all the time as people.
Yeah, no, I don't have a particular I'm just thinking about more a wide trend, and I think that I've seen, and men will be very insensitive about this, but then you'll see these threads that unfold on social media of like, so men objectify women, and then maybe women will take that further and they'll complain about it, but then they'll start objectifying themselves, and then you'll see men be like, well, you're doing it to yourself, in like a very nasty way. And the commentary on these types of things is more what I was referring to.
Yeah, I think there's an interesting particular tension here when we look particularly at something like a third wave feminism movement. And there's something about the agency that I think women, particularly through the third wave feminism, are trying to get access to by saying, I'm going to take back some of the things that were taken from me as a means of accruing social power. And
what is third wave feminism?
Well, what we would see is, oh God, you're going to catch me without a really clear, articulated definition. The choice-based movements of feminism that have come after kind of the more, we would say, the radical second wave feminist movement. So the third wave choice-based movement would be things like, well, I can choose to pole dance, or I can choose to, it doesn't matter what the impact is, my body, my choice, essentially.
Okay. No, that makes sense.
What I decide about my body is actually it is my social politic. And it's my right to decide for myself, even, and the critique perhaps could be, but what is the social impact of that? Or are you choosing something that kind of reinforces the thing that you were kind of trying to push against, right? That. But there's absolutely merit in bodily agency, especially as a pushback against an incredible lack of bodily autonomy. But I think to your point here, there is, again, hypocrisy, maybe I would use a different word, but I think it is complicated to look at how we're women in particular in and on media are trying to negotiate and navigate, how do I get autonomy back over my body that has been used, but is the only way to get autonomy back to do the very thing that was kind of using it. I like to think if your agency looks like reinforcing the ideal that hurts you, is it agency, or is it just an internalization of an ideal that you're trying to reclaim as your own? It's a tricky thing. And I would probably leave it up to that person and their psychologist and their pastor and their astrologer, I don't know, whoever they're consulting, to look at what's the inner working model? And maybe the thing that we're getting to here is do we actually have choice? Did the things that we think that we're choosing actually come from inside of us? Especially when they reinforce a particular social ideal? Or are those things that we've metabolized and they've become introjects, as we call them in psychology, things we heard so much that we took them on, internalized them, and we thought they were our own. Carolyn Knapp, she wrote the book Appetites, and this is talked about as well in the objectification theory paper, the 1997 one I mentioned. But when the anxiety is significant enough and was internalized early enough, it's a fairly well accepted idea in this particular discipline that we would say that the thing that you think you want might actually be the thing that you internalized so early enough, and you told yourself a really compelling story that you want it. When really what you're doing is you're enacting essentially what culture has handed to you as an ideal. And who could fault us for that when, we were talking about, we get reinforcement, we get social power for that.
Yeah, I mean, just to put concrete examples to this, and celebrities. That's a part of being a celebrity is people talk about them. So you look at Kylie Jenner, look at Ariana Grande. I mean, I think they've admitted, at least in part, to some sort of changes along the way to their bodies, and I think in many ways it's propelled their careers forward. But at the same time, they get a lot of, ridicule and commentaries and all types of objectification about their looks, and pressure to reveal exactly what they had done and all this stuff. And I'm sure they've got to be somehow internally conflicted about look, I don't want to keep doing more and more procedures, but people are saying all these things, and on one hand it's helping push my brand forward, push my movies forward, and it's a tough place to be in. I don't envy their position, but it does, I think it has helped push their careers along, some of these changes that have occurred. And they have to kind of wrestle with that all the time. And, people, they're on display for everyone to give, their feedback, I'm sure that most of it they don't, read or want to read, and probably it's better for their mental health. But it is a complex situation with celebrities, especially female celebrities. But the same goes for men. Like we were talking about Brad Pitt earlier, briefly, and his new movie and how
F1. Yeah.
F1. I mean, he looks very youthful and for his age, and maybe that helps bring more people in for the movie. I don't know.
But you've said that you've had people in Hollywood that like have come and that, like these agents are like literally telling them like, oh, you need to go do this procedure. Like it's like a common thing that happens in back channels. And yet I don't even know how many of those conversations are happening, but now you're having someone else come to you that is saying you need to do this for your career.
Exactly.
And maybe that conversation is like way more common than we think it is. I don't know.
I think it is. And again, it's not to say that it should be that way, but I think it just is that way. So it's complex. It's, it doesn't let someone, I think, fully take like control and have full agency, because they're not doing this in a vacuum. They're doing this because many times they do have, social circles to uphold and be a part of. If you look at the women who were there celebrating with, Lauren Sanchez and Jeff Bezos at their wedding, like there's a certain look there. And if you want to be part of that group and be accepted, and groups like that, let's just say, you're going to have to look a certain way. It just, it just kind of goes with the territory, I think. And I think many people feel that way in all types of circles, all types of social circles. And they feel like the pressure to conform and to, oh, you had this done. Okay, where did you go? I'm going to go do the same thing. Because they don't want to be left out, I think. That's just maybe one extreme example. But, again, just kind of using the celebrities that people are aware of to just point out something that I think all types of people experience in their regular lives.
I mean, the dangers of this are, I mean, we're talking about so many different factors that are influencing all these things, but then the trends that start to happen. I mean, in our solo episode, we started talking about people wanting to get facelifts in their 20s. I mean, even someone who's 20 years old, a 20-year-old wanting to get like a facelift or something like that because they want to change the complexity like in their face. Can you share a little bit about like trends like that, which is insane to me? I mean, that's like literally insane that like a 20-year-old would want to get a facelift, Yeah.
So I just posted a video about facelift risks and complications on YouTube, and it was almost shocking to me that there wasn't like a long form video on this. And it's a procedure that for the past few years I haven't even been performing. I've narrowed the scope of my practice, but it's kind of incredible that even though there's been the surge of people wanting to get facelifts, especially younger and younger, like not enough people are talking about the risks, because unfortunately, and like I've put out risks about, hair transplants and lip surgery and all the things that I still do. I've made videos about that over the years because, again, my goal is to make sure people are as informed as possible in making these decisions. But unfortunately, a lot of doctors feel like, well, I'm just going to talk about the positives because I don't want to scare people. And that goes for social media approach, but that also goes for when the person's actually like in their clinic and having a consultation. And the emphasis is rarely on, well, did you like review the risks? Do you understand that all these things could happen? And yes, there's forms people sign, but how much of it is actually explained to them is, not always so clear. So it was kind of amazing to me that there wasn't a video like that. So we just put that out recently, and some of the most of the commentary is super positive, and it's like, oh, thank you so much for this video. This is, really interesting. Like, just for people to be aware. And the numbers I quote about like risks of like nerve injury and hematoma are like literature based. And there was like one particular person just recently, and I don't really like to go, at people in the comments. If it's something super crazy, like I'll just honestly delete the comments, sometimes block them from the channel if it's just not a helpful thing for people. If they just disagree, that's fine. Let them kind of air it out there. But this particular person was like this is all BS. This is just you're just kind of like fear mongering. And I was like, that's interesting. Like I'm
about
giving
sharing the risks,
objective risks of surgery that's becoming more and more popular that people are doing at younger and younger ages. They need to understand this. And I wrote like a comment back to that comment. And then he or she, it was hard to tell from the username, but was just basically like, oh yeah, you're just scaring people basically. And I'm like, no, I'm just informing people of the reality, so that people know what they're getting themselves into. But yeah, I mean, the younger people start with any type of surgery, especially something that's more sort of quote unquote aging face related, will just increase the number of surgeries they do over their lifetime, which will inherently increase the risk overall of surgery, because every time we do surgery, there's scar tissue that forms, and you're going back in, especially facelifting. You got the facial nerve running through that area that the dissection is happening in. And, with more and more scar tissue, that nerve becomes, it becomes riskier to do that procedure and not hurt the nerve, So that is just something that I don't think people think about enough. They just kind of go for a facelift in their 20s now or their 30s, and they don't think about that cumulative risk, that increased cumulative risk. So I just think, all this stuff. And with hair transplants, for example, the younger you are in getting a transplant, like there are limited grafts. Like there's a limited supply. We don't have cloning yet. And God knows, when we'll have that. So there's a limited supply. And if you utilize a lot of those grafts, especially going too low on a hairline, like that is in many ways like an aesthetic risk, so when you're older and you have a crown that's starting to thin out and open up, you don't have enough grafts potentially to fill that area. And now you look unnatural and like something that, doesn't exist in nature. And
it's like this kind of opposite effect of what's happening that compounds, like you already had these issues and now like the whole entire thing that you did is now making it worse.
Yeah. And then you have as more and more surgeons offer these procedures and they're marketed to folks through social media and, somewhat like there was a time when a lot of these surgeries were just out of reach. Like initially it was because, they were just like in Hollywood and, maybe in like, New York City, a couple of places that offered them. And, it was expensive. And then more people started to offer a lot of these cosmetic surgeries and the price was still pretty high. And like, you couldn't just fly to anywhere to get a procedure done for cheaper. But over the last like 5 to 10 years, like medical tourism is more and more popular and sort of accepted. And it's not to say that, by flying to a place that you don't traditionally associate with like, very high quality plastic surgery that you'll somehow get a bad result. I mean, many doctors in these places are very well trained and, they go to all the courses and, they've done fellowships with people who, are known for good work and then they go back to their home country and they can deliver really exceptional care and work and they're cheaper, so people fly there and they could get really nice results. But again, it's just kind of like, just like the amplification of social media, you have the amplification of people offering these surgeries and, then people just can always now find, like within their budget, they'll find someone who will do that procedure for them. So the accessibility is just more than it's ever been. So like, it used to be maybe you may have heard of something, but it was just couldn't afford it, couldn't get it. And now it's just almost like an Amazon approach, where it's like, it's just so easy. You're on your phone, you click one thing and like it just arrives at your door. It's like, well, why not? It was just so easy to do. And so that is just scary when that becomes like plastic surgery, and you're just like one click away essentially from just jumping on a plane, getting something done.
It's Ozempic. I mean, I'm walking around the subway, you see like a big advertisement, like on the thing, like stick a needle in. It's like so easy.
I am so concerned about how easy it is to get Ozempic for people who don't have diabetes. Like the number of patients that I have who have been struggling with eating disorders for years, who can get Ozempic from their doctors, who are readily prescribing it without too much investigation into the underlying mental health concerns when they need essentially to be treated for their body dysmorphia and their eating disorders, and their doctors are prescribing Ozempic, and their symptoms are worsening and their mental health is worsening. And it's so easy. I think it's so interesting when even medicine gets involved in diet culture, when even medicine gets involved in the kind of objectification of women's bodies, and we aren't gatekeeping in the way that we need to as healthcare providers to look at like what is going on that is happening for people that is driving them to feel like they need to harm themselves in order to be okay, in order to be loved or accepted. Like you talked about the wedding scene with all these celebrities around them and like people just wanting to feel like, oh, if I can look like this, then I can belong. And yet perhaps it's my naive existential mystic heart that says like, there's got to be other ways for us to have belonging as a society besides feeling like we have to become different than who we are in order to belong. Because I don't actually think that if we know on some level we changed ourselves and that's what made us accepted, that we at our core are really accepted if we do become a part of something. I think on some level we'll always know that I'm only one decade or one change in my body away from losing the thing that I had to acquire by changing myself. And if we've had to adapt in some way in order to get the kind of belonging that we need, whether we want, that is like a longing for us as humans, then I think it's hard to actually at our core accept that belonging as being about us and not just about the change that we made.
Yeah. I think one thought, and this is almost like a question for you, Hillary, like with this increased accessibility and like dropping sort of costs of plastic surgery, it's like on one hand though, they're dropping in some places, but you have the other extreme end.
Sure.
For facelifts in particular, there's colleagues out there charging $250,000 for, let's say, a series of procedures that might include a facelift, a brow lift, and all these things, but they do it in a day. I mean, that's like that, whatever, there's that extreme. But where I was going with this was like, with that change in plastic surgery, like, do you feel like for mental health care, has it become more accessible and like both in terms of just people being able to easily reach mental health worker or like being able to like afford one, has there been enough advance in that? And I guess what needs to happen for that to be even more possible?
Right.
That's expensive too.
Yeah.
People.
If people are going to change and the only accessible option is the more accessible plastic surgery, and it feels like it's a one-time thing versus a therapy journey to process decades of childhood trauma is going to be an extensive and long-term process. I think there could be some people who weigh that out.
And more difficult in many ways.
Much more difficult. And I mean, I guess depends, assuming that the surgery goes well and there's no other concerns, but it is a really difficult thing to go to therapy. And so you're right. Like we need to have availability of mental health treatment. We need to have accessibility. I mean, I think it's a little different here in the States than it is in Canada in terms of like how accessible it is. What you sometimes have to actually meet a certain threshold of acuity of mental health concern to get the kind of treatment that you need. And then there's lots of options in Canada. But of course, healthcare it's a bit of a different scene in Canada, which includes mental health care. I think what I want to highlight is that mental health, the only way to intervene around our mental health is not therapy. In fact, I often think that that's kind of like should be like a tertiary level of involvement, that good mental health care starts with really secure attachment and connection and belonging. There's movement involved, hobbies, right? Expressing ourselves in the world in ways that we're creative. All of those things are connected to mental health. So you don't actually have to have a really good psychologist to have good mental health care. And I think all of this leads us back to some of the, the things I mentioned earlier in the tripartite model. We have peers, we have media, we have parents. Ideally, we have older, wiser people in our life who are speaking into our life, who are supporting us to create a sense of like way of facing the world and the tasks and demands of living that, we need support around, and we need peers, we need friends, we need connection. I think that the change in the religious landscape in North America over the last 10, 15 years is also a part of this, that people are more on their phones, but they're probably less likely to be in church. They're probably more likely to try to be meeting people in different ways than they would have had like a kind of baked in community context. And then we have media, like what kind of media are we engaged in? So when we're looking at mental health, we want to think about each of those factors, like who's around me, who are the people who are speaking into me. And that could be a psychologist, but it might also be an elder, an auntie, right? A friend, a parent figure, a pastor, a leader. And then what kind of media am I watching? Because there is actually one of the things that we're seeing with the rise of social media is like there's more accounts where there's like more information about mental health. Like, okay, meditation, right? Am I seeing accounts that are kind of buffering against some of the impact of things? And are those actually helpful for my mental health? And then who am I talking to? Who am I in relationship with? And am I, again, like I mentioned, I'm thinking about Seligman's PERMA qualities, like the qualities for flourishing in mental health and well-being. We need to be able to move our bodies. We need to be able to experience nature and have a sense of meaning. And those are things that maybe a therapist helps you with, but ultimately other people could help you with as well.
Also, I think like we're not being exposed enough, just like we, meaning, I don't know, just like current culture. And this is just not just in North America. I think it's like more pervasive than that, but like not being exposed to the cycle of life, both like city living, like you don't really see like plants dying much, you don't see like animals dying other than maybe like a mouse on the, on the side of the road or a pigeon. But it's just different, I think, where it's like, farm life when it's just like, you're just surrounded by life and death, and like that becomes like, that's normal. Also, this whole concept of like more like individualism and, not like living with your grandparents, like if you see your family members, not only the wisdom you gain from them, but like if you just see them kind of getting older, and that just kind of like, I mean, there's a sadness to it, but there's also like a beauty to that whole process. And then, and like we're just not as exposed to that, like in our current lives, at least. I mean, I guess speaking from experience here in New York City, but I do think that it's kind of a changing world all over, even in places that are more, where it's more culturally accepted to kind of, live with your extended family and stuff. Like even other parts of the world are starting to change. And I think that is probably a negative for like our mental health and how we perceive change, and changes in appearance and changes in other ways too.
Yeah, body image. What if we never see an aging woman? What if aging women disappear? What is that going to do into our normative sense of the life cycle? And then the ability for women who are not engaging in procedures to be able to say like, oh, I saw this and I saw how beautiful this was, and I saw that it could be good.
Yeah, I mean the Kris Jenner thing a month ago, or whatever, with the facelift was like, it caused this like massive firestorm online of like she got a facelift or whatever, and her appearance at 70 now looks, and when it's real, like if it looks natural and it looks good, like, and I don't know, probably cost $250,000 or something like that. Literally, she looks, in some of these pictures, like 45 or something like that. I don't know. Like she literally doesn't look that much older than her daughters. And so for people that are at that age, it's like aging itself is becoming something that is like uncomfortable for people. It's like a very uncomfortable thing to see your skin sag and see your hairline recede, and like the normalization of that. And then when you throw in the fact that the objectification thing and the social reward. So let's just say a woman has been celebrated her whole life as being sexy and beautiful, and like, let's just say they're even a sex symbol in the most like extreme example. So she internalizes that in their 20s, 30s, and then you start aging. And then the entire thing that was your identity for so long, you're now a 55-year-old woman, you can't play that card anymore. And it's only so long before that catches up with you in the sense of like time is undefeated, time is undefeated. I mean, like you can get surgeries in 55, like up to 60 or whatever, but like your body is just going to do like what your body's going to do. I would imagine, and I don't know if you've seen this in your office or whatever, but like that could spur on an existential crisis of like, the thing that was so valuable about me, the thing I was praised for in my own life that I maybe even enjoyed at some level to be celebrated in that way, that I'm so beautiful. I'm now 55 or 6. And I just find that to be kind of devastating, to be like a middle-aged person. And the thing that you were celebrated for your whole life has now been ripped away from you. Like, what are you now?
Then you have people who like were never celebrated for their looks, really. And then they like worked really hard, let's say in their jobs, and they reach the point where like they're seeing these changes. And maybe there's always been something that they didn't love about their appearance, but now they have like the money to actually kind of get some of this done. And I see people like that too, and it's just literally been decades of they've been thinking about certain procedures, or they're starting to see change, but now they can afford to do something about it, let's just say. So you have a lot of people who fall into that camp as well. It's not like, that definitely what you're talking about is very real too. But I would say there's lots of folks who just, they've been bothered by something for many, many years. And now they're like, now I'm going to do something about it. So yeah, there's different scenarios. The Kris Jenner thing, I think in plastic surgery, there is this concept of like people looking age appropriate. And, it's not like you have some surgeons that always kind of create age appropriate results and others that don't. But there are definitely surgeons that care a little bit more about that than others. And there's some that actually celebrate the fact that someone's looking, 30 years younger. I think like, even if we can do it, the question is, should we do it? Like, yes, you can do a deep plane facelift and lift up all the sagging tissue, reposition things in a way that looks not pulled, looks quite natural. You can do a fat transfer to bring even more life to the skin. That's oftentimes what is being kind of coupled with the facelift these days. You can lift up the brows. You can remove extra eyelid skin. And the person really can look 20, 30 years younger. But is that a good thing? From like a plastic surgery goal, I'm talking about people who are going to get plastic surgery, or is it better to do something less, like slightly less invasive, slightly without all the added bells and whistles, where they can still look like a woman in their 60s, 70s, but just a bit more refreshed? I mean, there is something to be said for that from a more surgical perspective. Selecting procedures that, just kind of enhance where someone is in their life, but not turning back the clock 30 years. I mean, I think that is an extreme form of intervention. But even, some of the best facelift surgeons, like no one's talking about this. This is, I would say, on the controversial side within plastic surgery, because, the same, like, even though sometimes you might not know which surgeon, operate on these patients, but there are sort of these all-star, like, let's just say facelift surgeons, right? And they are applauded when they post the result and the person looks 30 years younger. Should that be celebrated from a plastic surgery perspective? I'm not so sure, So you have the people getting facelifts, let's say, when they're way too young, like 20s, 30s. I mean, that's a very new concept that is over the last, 5 to 7 years. That's like a COVID phenomenon, to be honest with you. It's
a Zoom thing you were talking about earlier. Yeah.
It's the Zoom thing. It's just kind of how accessible all this stuff is, and surgeons saying yes to younger. That's one of the reasons why I got out of the facelift game, to be perfectly honest. I got tired of younger patients asking me for that and then being upset when I said that you're not a candidate. Like you got to wait, 10, 20 years, and then maybe you'll become a candidate. They would just find someone else to do it, and so you have that, and then you have the people who are older and maybe qualify for a facelift, But it, like, with all the things that are being done, with all the extra add-on procedures, you know, now you're making them look like their daughter. Is that a good thing? I'm not so sure. So.
I'm hearing this through a few lenses. The first is the sexual objectification conversation again, which is to say that women, particularly in our culture, are valued for being sexual objects. And typically, as women age, they are seen as less sexual objects. So when we can't objectify women sexually, generally, what do we do in our culture? We try to make them change, or we discard them, right? So you see this kind of invisibility around the aging woman. She just kind of disappears. And my doctoral research specifically looked at the biopsychosocial transition of menopause, and in particular, what happens when it goes well for women. Like when we look at the aging experience for women, what happens like when they feel empowered and embodied? Where are those women? Because the research literature really hasn't said a lot about women and menopause and well-being. We tend to see aging women through the lens of this kind of like this body that's decomposing, it's discarded, it's a problem, it's a pathology. But what about the story for the women who are saying, actually, I feel more connected to my body, I feel more empowered than ever. I might be socially invisible, but actually, I feel relieved to not have to play the sexual object game anymore. So what we found in our research, and these are findings that are consistent across the literature, is that women have this kind of like fork in the road moment as they're aging where they say, okay, I've been handed the script of I have to look a certain way. And there's a developmental crisis, which happens at every developmental stage. When you're a teenager, when you become a parent, you're like, am I going to be able to do it or not? Am I going to lose who I knew myself to be? And you face the developmental tasks. You have people around you who support you, you meet the demands, and you figure out your way and you find your way through. So is it an existential crisis? It might feel like it, but if we've been supported by people around us to know, hey, this is going to feel a little different, this is going to be a little unusual, you'll find your way, I did too, then we can kind of meet the developmental tasks and come into more power. When that doesn't happen is when we try to resist the developmental transition and we say, I'm just not going to go forward. I'm going to stay where I am, and I'm going to try to use more and more efforts to prevent the thing that's happening from happening. So for women in particular, what this looks like is I double down on my efforts to change my appearance and then feel an incredible amount of shame and distress, usually about it. And you're right, like time always wins. Some point there is like a relenting. We see across the literature that body image for aging women is kind of like, I care less about it because I can't really, right? So even if you tried at some point, maybe there's like distress, but then eventually there's a kind of letting go. But then there's this other road that women can walk down, which they say, oh, thank God, I'm out of the game I never asked to be in. And there's crisis there too of like, am I going to hold on? Am I not? But the kind of allowing of the process to happen of accepting our body to say, wow, maybe that way I was turned into an object actually didn't feel good for me. And I can connect with how good it doesn't feel now that I feel that it's not happening. And I can move into this place of claiming all of these other things about being human that I was distracted from when I was convinced that the only thing that mattered about me was my appearance or this kind of social power. Now I have an other kind of social power, which is I know things. I've seen some shit. I've been around the block, and I can actually pour into creative pursuits and my identity in another way and nourish myself and maybe like the next generation.
Yeah, I mean, I think this is one of the most deeply unfair aspects of society in the way that men are socially advantaged in some ways than women. I mean, to get to an age where you treat women like a sexual object and then discard of, and then men don't necessarily have to face those like same pressures as women, and they could be 60 and looked at as matured, or date like a 35-year-old, and I have my business and a tech thing, and now I'm like socially desirable or something like that, and then to just be like, well, you're a woman and you're 55 now and you don't look like you are anymore, like what's your purpose anymore? I think it's like a very sad reality, and those narratives need to be really addressed. I mean, that's, whatever way you want to talk about plastic surgery, Ozempic, I mean, that aspect of it, of like, you don't have value anymore.
Yeah. Well, I'm sorry to interrupt you.
No.
Okay. It's like, I have to say so much to say. That there's this way that we do it in the academic literature too. Like when I started doing my doctoral research and looking at the academic research, there's very little out there about women speaking from their own voice about what it's like to age. In fact, when we talk about aging women and their relationship to their body, there is a particular story that's told about the body being a problem, even in the way that we construct it academically. So what I was trying to do with my research was say, I don't think this is the only story out there. It's just not the only story that's told. And where are the women who are saying, I exist and I feel more connected to myself than ever, and being like out of the game, out of the social script, has actually connected me more to my power. So what we do is we silence the narratives academically, in media, even in our relationships with each other that go against the social script. In fact, there's a scholar named Mimi Nichter who talked about this in terms of the language fat talk. And her construct of fat talk was that women socially connect by feeling badly about their bodies, right? So if we can compare our bodies, then we can be connected to each other in a social world that says, this is how we do it. But in a research study that I did that looked at women who love their bodies, what they found was that there was really no place in their social, connections to talk about the love for themselves. It was like the script doesn't allow for that. So we kind of hit a certain point in saying, I'm actually kind of okay with myself. And then the relationships don't really know how to hold the self-acceptance. So the fat talk principle is that women have bonded over hating their bodies in a society that has told them that that's actually the way that you get power, right? We can compare diets. We can talk about plastic surgeons. We can talk about procedures. We can show photos of before and afters. We can feel connected over devaluing our own bodies, over objectifying our own bodies. But when there are women who say, I'm actually okay with how I look and I feel really connected to myself, even in aging or in youth, where do they talk about that? Where is the space for that? It doesn't sell. You can't sell a product to someone to change their body when they're like, I'm good. And where do we allow for women, particularly aging women's experiences of menopause, of aging, even of dying, for people to confront their own death and talk about there being power and agency in that? It seems like we just don't really have social scripts or room for the okayness, which means they disappear, they go underground, or they cause relational rupture. And so I would like to see that there's more space to talk about what's going right. I'd like for us to have space in conversation to talk about how does it feel good to be you? How does it feel good to be you? Even we were talking earlier about, you were talking about the things that you feel insecure about your body. And I talked about my dad, and we can talk about those are things that are just so much more accessible. But what if we just sat down here at this table and I was like, and what feels so good about being you? And what do you love about being a body? We could do it, but where do we go from there? We might not really know how, or it might not be something that we're disposed to think about.
I don't even feel like that's not really it's not really a conversation, because I think a lot of people don't think exists. I don't think people don't think it exists.
People don't think it exists. And why don't they think it exists? Because we don't see it, right? We don't hear it. We don't see it. We don't see it in academia. We don't really see it in medicine very much.
Positive stories about,
about loving yourself. And I could have a whole soapbox conversation about loving yourself, which doesn't just mean you're totally enamored with everything about you, but real love. When we think about a marriage or a relationship, you're okay, I don't love that that's what you do when you're doing the thing, but I love you and I'm with you and I'm committed to you. And thinking about body love is not just thinking everything about who you are is perfect and ideal, but rather I'm committed to this journey of being myself and I see the goodness in it.
Yeah, no, it makes total sense. But it's also happiness, I don't think we're always focused on the things that, are making us necessarily happy. It's a lot of it is oh, well, the rent's going up, or, the whatever, there's all these wars in different countries. It's a lot of us, it's what we see in the news, but I feel even within my own, loving marriage, we talk a lot about kind of quote unquote negative things that we're trying to solve, not between the two of us, but just we're just trying to tackle different life problems, you know what I mean, that come up. And, it's I feel a lot of our focus is on that, rather than constantly sitting down and be oh, isn't this amazing? If anything, it's all the amazing stuff is usually about like our daughter, you know, like, whereas everything else, like, okay, we got to figure out this issue, that issue, you know, there's always these issues,
right? The problem solving,
and then it's like you kind of save it for like Thanksgiving or some equivalent holiday around the world, where it's like, okay, we're going to say what we're thankful for, but then every other day we're going to like try to constantly problem solve, and like, you know, this could be better, that could be better. And so I think it's like a general approach like we humans seem to take, is to not always to think about the positive and to discuss the positive. I don't know why that is, but
we call it the negativity bias. Actually, there's an evolutionary purpose for it. If you're like, you see the thing that's wrong, then maybe you can fix it and get ahead of it. But if we're going to evolve past just survival into flourishing, I love Antonio Damasio says we have a biological imperative, or we are organized. Oh, what does Antonio Damasio say? We have a biological imperative to flourish. Maybe I'll just say, there's a famous neuroscientist who said we have a biological imperative to flourish, that there is something that is even more right about us than just surviving, which is moving us into our kind of like creative expansion, and our, maybe you could say like our spirituality, which is that like our sense of meaning making in the world, our ability to make things and to feel good and have a sense of purpose. And that takes us out of the conversation, or it necessitates us being out of the conversation of like, what's wrong with me, to ask like, what's so right about me? And how do I connect to what feels good and right and alive in me and in the world?
Yeah. No, I feel like we're at an inflection point in this conversation, because it's like, what is it? You mentioned happiness, or you're mentioning all these things. Like, what is it that we actually want? Like, because I feel like we can have this conversation, but like, what is the goal? Like, and maybe the goal is an ongoing thing, but I think to name it, for people to have like a reference point, what would you say that is in this conversation?
And you're asking like, what is it that we want as a species? What is it that we're wanting as we're trying to change our appearance?
Yeah.
What is it?
I think at the end of the day, like, what is a worthy pursuit in this conversation? Like, what is it we're actually after?
A mighty pursuit.
You just left
like,
it
what is it? Like, because at the end of the day, people are just chasing and doing these things, and maybe sometimes it's reactive, but unless you're clear on, and that actually is a restoration of agency, of like, this is what I'm actually after in life, and this is how I'm going to pursue it, and these are the paths I'm going to pursue, rather than just kind of reacting to your environment, reacting to the social media posts. Like, so what would you say about that?
Well, I feel drawn to theory, and then I'll speak from the heart. Like, from theory, I think about the foundational things that we need being connection, safety. And then if we look beyond connection and safety, we could say mastery or affectance. Like, I want to have an impact on the world. I want to do something. I want to like look at the world and go like, oh, that looked a certain way, and then I came along and I did that thing, right? Like, we want to leave our mark on something. And then we also want to have a sense of meaning. Like, what am I doing here? What's my role here in the world? And that's, I think, connected to affectance. Like, oh, I want to be able to act on the world and feel like I know my particular flavor and role. And if I speak from the heart, I would say we want to know we're loved, we want to know we're safe, and we want to know that we matter. And we want to be able to express ourselves in a way that makes us feel alive. And I think that's underneath what's going on for most of us as humans, is trying to get one of those needs met. Like, maybe if I change this about myself, then I'll feel safe, or I'll feel loved. But maybe in the effort to try to get into the safety and the love, we miss the ability to connect with how safety and love is here, but maybe in different ways. Like, could it be in the relationships that I have around me? Could it be in presence? Could it be with like being in nature? Could it be with my family? And things that don't feel necessarily aggrandized, but are simple and human at the end of the day, are going to make life worth living. And can I find out a way to be me in the world that's uniquely me and lives my vision and my purpose, and has a sense of feeling like I know who I am. And I think that I know who I am is often connected to a place inside of us, regardless of how we look on the outside. In fact, you can see from the research literature about things like embodiment that the more a person has contact with what we call interoception, the felt sense of what's happening inside your body, the more inoculated you are against body image pressures, conversations in media, things that move you into objectification. That if you're connected to what's inside of you and you have a sense of knowing who you are and being connected to the way that shapes decisions and desire and impulses, then I think that helps us live a life that's organized from intuition and meaning instead of from the gaze outside of us that we've learned to internalize.
Really well said. I think the specific objectives will vary from person to person. I think a lot of people are happy just going to, a very kind of secure job that doesn't maybe require like a ton of pressure, a ton of like maybe even like extra thought. They go to work, they come home to their family, let's say, they watch some Netflix and they just repeat the next day. There's no necessarily lofty goals. There's no like massive like financial ambitions. I think that's probably the majority of people. I don't know. That's a sense that I get. And then you've got people who are have I don't know, specific objectives. We're probably all that way here at this table. And from my experience, I mean, that goalpost keeps shifting, like that's how my brain works. Like I set a goal, then you hopefully arrive there. If it's like a practical one that can be achieved, and then you kind of set the next one and it kind of goes from there. And I try to look back and where I started and be like content with the path and where I'm at now. But part of me is always like, oh, but you could also do this. And like, what if you achieved this? And like, and then what are the things that you have to do to get there? And maybe there'll come a point where I'm no longer like striving towards, I don't know, a new goal. But I think that's kind of how I'm wired. And the goals are definitely not like, just financial. I mean, some goals I think for all of us are probably that to a degree, because a lot of times to do something different or to contribute to different causes, I mean, it's helpful to have certain finances. But it's also, like you said, like making just a name for yourself, getting some kind of recognition for something you've done that you feel good about. But I do think that there are plenty of people who don't have like necessarily like these lofty goals, but are looking for some of the basic things that you said, just being appreciated, loved, supported. I think that everyone sort of wants, unless there's something really disturbed about someone who doesn't need that. But yeah, I think that's like definitely like the basics. But then you have individuals who want to achieve in different directions, whether that's in the research world, whether that's helping the earth be a little cleaner, or helping, fellow people in different ways. There's so many ways to help each other, right? Or some specific financial ambitions where some people don't really care about making any special name for themselves, but they're just looking to like just make more money. That's, I think, a fair ambition as long as they're not hurting anyone along the way. So there was all types of things. So I think for each person, it's a little different on like what should it be for them that will make them sort of happy or happier.
So the question for me becomes like laying out these goals or things that we want. Is Ozempic or plastic surgery ever a valid solution to fulfilling those goals and desires?
I will always say, and this comes from my work as a trauma specialist, as a trauma survivor as well. When I think about the people who come into my office, who I sit with every day, whom I adore, I will say that there is nothing wrong with the desire inside to try to feel loved and safe. That is a human inborn longing. Will we get that through any number of means? I think it remains to be seen. But I want people watching this and listening to this to know that that place inside of them that longs to feel safe is good, that place inside of them that longs to feel loved is good. I want to think about less the individual and more the societal when asking that question is like, what happens to us as a society if we think that's the answer to love? I think that as a society, we've restricted and constricted the human experience to this very flat, narrow story. If we think that appearance is the only way that we should be loved, or if that's what we can offer people, then we're missing something. But I'm never, ever going to sit across from someone who wants to change their body and say, you're bad for wanting to feel safe in your body when you were made to feel so unsafe. And let's see if that actually helps you get there. I'm not sure that it will, but you're not bad for wanting to be okay. You're not bad for wanting to be loved.
Yeah, no, I think that's important because you're separating what the desire from the actual outcome. And so that distinction and that nuance is extremely important. I think that it's like, is the actual action going to like do what you want it to? And so like, and I don't even know if like how you measure this. Maybe you could see it from a perspective of someone's long view in therapy, in your practice. You might see it from a lens of, oh my God, you did my hairline and I'm so satisfied now and I feel so much better about myself. And is that a temporary thing? Is that a temporary 3-year thing where they feel good and then those, boom, you're right back to the issues that you were at before? I don't know. What are your thoughts on this perspective?
Well, I think, Matt, I mean, it's all temporary because we're temporary. So it's all temporary. But, you know, I think the best patients that I have are like, and most of my patients, I would say, and my favorite type of patient is like a happy person, you know, comes in happy. Like most of my patients are not coming in miserable and like a full list of problems and occasionally, but most patients I have are like normal people with like successful careers with, you know, many have families, kids, and they're not, you know, necessarily like looking for a spouse. I mean, we get, you know, people who, you know, are telling us that they're, you know, they're trying to do better on dating apps. I mean, you get that, but most patients are coming in with like a pretty good head on their shoulders, at least, you know, to me, who are coming to me. And I find that with, again, like properly performed procedures that are working with like what is an acceptable like type of result that like is natural and they can be happy with, and as long as it's in line with what their goals are. Like these people are just still happy people after the surgery. They're just a little more satisfied with that element of themselves. The people who come in and they're somewhat miserable and they can tell have had a lot of other procedures done, they share that with you, they have other problems in their lives that sometimes they'll admit to, it's very difficult to get that person to like a quote unquote happy state. And those are the people where after surgery is, you know, even when everything goes really well and they have a, you know, fairly imperceptible scar, or they have a just objectively like a nice result, they'll always find something to still complain about. So I think it's like definitely an underlying like state that, you know, if the person's just not in the right frame of mind, like doesn't really matter if they had plastic surgery or not, they'll still kind of be unhappy. So yeah, the way I see cosmetic plastic surgery is very much just like if you're, you know, it's kind of like when people, like if they want to get like a nicer car or like a fancier watch, you know, for some people that's a big deal and it makes them feel good about themselves. And is that temporary? I guess so, but you know, like it makes them happy. I don't know. Like I'm not like a watch guy or a car guy. Like it just doesn't do much for me. So I don't really chase that. But to each their own, you know? And that's, I think, the way to look at it. Like there's definitely like a deeper whatever, but I think the most ideal patients have it all mostly kind of figured out in their lives, and they're just looking for that like extra enhancement rather than like depending on the plastic surgery to transform their lives and then all of a sudden they'll be happy again. I mean, that is not how it should be sort of quote unquote used. That's my opinion just based on everything that I've seen. So most people do need to do that deeper work. In order for them to just kind of have, I think, more like happy and fulfilling lives, and plastic surgery shouldn't be seen as a way of getting there. But
the rates of body dysmorphia in the general population in North America are about 1%. In the populations of people seeking aesthetic surgery, in particular, would you say aesthetic plastic surgery or cosmetic-based plastic surgery?
Yeah, similar.
Yeah.
Yes.
Are between 7 and 15%. And what the research shows, that's as recent as 2022, that individuals who are seeking plastic surgery for aesthetic reasons who meet kind of sub-threshold clinical presentations of body dysmorphia would be closer to 18 to 20%. What we see is that for people who have that underlying presentation in the literature, that they're not going to be satisfied necessarily. And so if it's really to your point, like what are the reasons that people are coming in? Depends on the procedure as well. What's going on for the person? What's happening for them on an underlying day-to-day basis? Is there a trauma history? Are they trying to run away from it? Felt like, their body was taken from them. And so now they're trying to kind of like take control of their body. It's really hard to treat childhood trauma with an aesthetic plastic surgery. We know for populations of people who experience a breast augmentation surgery that rates of completed suicide are 3 times the average rate of the average citizen in North America. So if you have 3 times the rate of suicide after a procedure, would you say it's working at making you happier? Probably not. But there's so many factors that go into that. Like, why is a person wanting a surgery? Why are they trying to change their body?
It shouldn't be seen as like a Band-Aid, on deeper rooted problems. And all too often, I think it's seen that way. And I think all too often, surgeons just say yes to make some more money, as opposed to like really trying to like care for the patient a little bit more holistically. Yeah. And that's part of the issue.
Yeah. So I think that what's interesting is we're talking a lot about like an individual level, how this affects, but like everything in society acts as like a contagion. And so I think one of the weird narratives that has developed in recent years is as long as it doesn't hurt anybody else. And like, so I think that, and what I mean by that is like, yes, you're making your individual decision, but if everybody makes a particular decision about something, how does that affect society as a whole? And how does that influence the decisions that other people are going to be made? And so I wanted to get your guys' take on that in the sense of, do we have a social responsibility to also be thinking about those things as we make decisions about our bodies?
Well, if you're online talking about it, then there's like that social impact. I think if someone's just going in and getting something done for themselves and they're not talking about it to anyone, then I guess you could argue that it's just their call to make, but they have to understand that they might themselves be injured by the process, because if it's something like invasive surgery, there's real risks to that. So they'd have to understand that. But yeah, if they don't then propagate that information about having had something, then I don't see how they're like hurting anyone potentially. But if you have someone who gets a procedure, let's say, they got it done for free so that they can like talk about the clinic and the doctor and say how great everything was, and they're voicing that to lots of people on the internet. They're then part of some potential perceived problem. I think it depends on how they talk about it and how truthful they are, and maybe giving a more like real sense of their experience, maybe the pros and the cons, something like that, where it's more balanced and not just like, oh, this is amazing, everything was perfect. It's like, come on, we know there's a recovery period to it. We know that, sometimes problems occur and, you can get over them, but like, just talk about it. If there was maybe even if it was like a small little complication or your wound wasn't healing well, like just nothing wrong with mentioning that so people can then, understand that that's part of potentially then their journey. That's the way I see it. You could also say like my whole channel, I guess some people would say is like, or what I do is like, shouldn't exist. I imagine there's folks out there with that opinion, but the way I try to maybe justify it is to say like, I'm going to give people the good, the bad, the ugly, and then have them make an informed decision. And as long as I've done that, then I don't think it's a disservice for anyone. And if anything, it's the counterbalance to people putting out all this like positive stuff, like, oh, look how great this looks, and we can go to wherever, Mexico, to get a surgery, and I can afford it there, or I'll go to Turkey to get my hair done. And it's like, whoa, let's just like, it's not about what country you go to. It's about like really understanding the pros and cons of the procedure. Do you even need it? Do you want it? Why do you want it? Like, so that's the approach that I take, to just kind of educate people in every way possible, and then they can make a decision for themselves. To act like this stuff doesn't exist and that it's going to somehow just go away is also not realistic, in my opinion. So,
do you think the before and after picture is a problem in itself?
Any before and after picture?
Well, I mean, because implicit psychologically in the photo is left is bad, good is right is good. Yeah. So as soon as you see it, there's contrast. So if you are the one that you look similar to the one on the left, and then you're like, do you think that photo, that because that's everywhere on social media? It's popped in the Explore tabs, whatever, and it was referenced up the top of what I was talking about from Jamila. Jamila's a before and after picture. So what
before and after? Yeah, I mean, there's some communities. I think it's like in Meta, you can post it as like an organic post, but you're not able to like put ads behind it, because then I guess it's just not allowed with their community policies. So I mean, I understand like the potential like negative impact that could have. Honestly, a lot of my before and afters, the biggest compliment is when people write like, I don't see a difference. That looks like a before and a before, because like good natural results like don't actually, scream plastic surgery. But again, that's maybe a slightly different conversation. But yeah, I mean, again, it's there. It's not going anywhere. There's lots of things to say. Like again, more nuance up before and afters. Like a lot of people, so they're stealing people's results or photoshopping the results so that they look, maybe better than the real thing, or like lighting conditions that you can't even compare an image, so you don't even know what the hell happened. There's like all types of like technical issues with before and afters, but as a general thing, before and afters, yeah, I mean, it's kind of here to stay. So I think we just have to make the best of it and just make sure people know that they can be duped by a before and after if the lighting is totally off or the angulation is off. I mean, I can take 20 pictures of someone's hair, and if I comb it in a certain way, if I change the lighting, it'll look like the hair is amazing or the hair is really thin, or there's like all types of stuff. So if you're trying to, let's say, show people like, this is my surgical outcome, I think it would be doing people a disservice to have there be so much discrepancy in the conditions in which the before and after was taken, especially if it's a consistent problem. I mean, no one's perfect. Sometimes your camera changes, your lights went out, you have to use a different light, but you can tell which providers are really trying to like bring that consistency forward in terms of the way they capture their images, so that it's like a true like result, and not just something that's kind of faked or people are kind of tricked into thinking it. But yeah, I mean, again, like there are going to be people who just disagree with cosmetic plastic surgery, and I think that is one camp. But again, like to just, there's certain things, it's like AI. I don't think like, yeah, you can be completely against AI, everything, but like it's probably not going anywhere. So trying to figure out how do you work with it, how do we contain it in certain ways, I think is a healthier discussion. And the same goes for plastic surgery than just being like, oh, we got to wipe out all before and afters. We got to get rid of all AI bots on everything like that can't exist in society. It's just not going anywhere.
I think social media has tricked us into thinking that our social media accounts are the only way we influence. And if we go back to the tripartite model of influence, we know that body image and kind of this internalized narrative and feeling we have about our bodies is the end result of a series of influences that media is only one of which. So parents or elders, people in our life and our family, siblings, and then our peers and the conversations we're having. That model of influence suggests that those are the pathways that messages about bodies get into us and shape how we're feeling. But we forget sometimes that we are also one of the peers or maybe one of the parents, or we're creating the media. So yes, we want to think about what we're saying on media, but also how do I parent? What do I say to my friends? right? Do I let people into struggles that I'm having? Or does it feel like the only way that we connect is to talk about what we're going to change about our bodies? So looking at influence as bidirectional and including so many different sources or pathways or media, you could say, there's like these pathways of messages that we are also participating in terms of like expressing how we feel. And then as a result, disseminating some of the ideas that we've internalized about patriarchy or sexual objectification or misogyny. So when we think about influence, let's actually just like take social media off the table for a moment and imagine a world in which that isn't the only form of influence. Who do I interact with? What am I saying to my friends? What am I saying to my kids? Right? What was told to me by my parents about bodies? Like, as we were sitting here, you said, I can hear my mom's voice in my ear. She's telling me about my posture. I can hear she's getting, if she was here, she'd see this, right? Like, we all have these introjects from parents as well that are internalized inside of us that we unconsciously pass on to our kids when we think about what we're feeding them and the conversations we have about, oh, don't eat this and don't eat that. And the concerns that we're engendering in the people that we're around based on what we tell them is a problem. So yes, we are all these mediums for the cultural stories at large. And that also gives us another point of agency to come back to agency and say, what if I could be the alchemist to pass on a different message? What if the thing that is being disseminated through my conversations, through the way that I hold myself, through the media channels that I engage in, to do something different? In one of my earliest research studies about body image, I looked at mothers and daughters and how messages about body image were passed from parents to children. Mm-hmm. And what was fascinating is I asked mothers, what did you tell your daughters about their bodies? And the mother said, oh, I said, love your body. I said, it's okay, whatever size you are, you're beautiful no matter what. What the daughters heard and what they saw was a completely different story. Because I interviewed the daughters as well and said, what did your moms tell you about your bodies? And they said, I can't remember much, but I remember them standing in front of the mirror holding onto their excess skin that was hanging over their jeans. And I knew in that moment that that's a thing that I shouldn't want for myself. Because we know that communication is both direct and like through the words that we say and through modeling through our behavior. So how we are living as people is also influencing each other. What do people see us doing? Like, we're in New York City. I was out on the street and I could barely get across the street because there was someone who was wanting to stop everybody to get a perfect photo of themselves in the crosswalk, right? It's like for media, right? But that's also impacting the very embodied real experiences that we have. So I'm thinking about this as a scholar who's researched the way that we pass messages on. And those messages are not just through phones and images. They're also through the posture, the checking, the primping, the managing, the concealing. I mean, I had a baby. I had a vaginal birth at home, which is not the experience that most people had. But I had the experience of coming through delivery and feeling like I can do anything. And I can do anything in my real life, in my body, in my home. And we had a photographer come over and she was going to take photos of my daughter and I. And I had said, take some photos of me naked with my large belly. And I always like to joke my areola, the size of teacups. Like my boobs were enormous. And I just felt like I've never been in this shape before and I will never be in this shape again. And I don't want it to disappear. I want to remember look at how fat I am and how beautiful it is. And she said, I've never had a woman ask me to come over and take photos of her naked body where she's not concealing her body by propping the baby in front to hide her belly. And I remember thinking, that's so sad. Like I've never felt more alive and connected to myself. And not that every woman should, or I'm suggesting that this is some sort of new ideal, that there isn't room for the complexity and the challenge. But for me, it felt like I want to be able to look back and I want to be able to show my daughter that my body did that. And right after she was born, I was proud to say my body did that. And this is how I expanded. Isn't that amazing? I made room for you. Look at how big my body needed to get. And it wasn't just valuable when you were inside. My body was valuable even after you were born.
That's great. Mm-hmm.
Such a countercultural perspective.
So to the before and after point, like, is a before and after a bad thing? No, because we're always changing. Like I had a before and after my friend made of me the day before I gave birth and then the day after, right? Is the question is, what are we saying with the before and after? And if the before and after is a way to say that you need to disappear as a body, that your body needs to look like the ideal, and that's the only way that you get praise and reinforcement, I think that's a problem. Should people not be changing their bodies? That's like a much more complicated question. It's like, should a person who has an amputation not get a prosthetic? That's a body change. Should a person who has a cleft palate not get a surgery so that they can feel like they exist, they exist within kind of the spectrum of normal, that we understand it? That's not what I'm suggesting, but there's a particular way that before and after is used to reinforce bodies should look like this in order to be celebrated. And I think that this is often thin, is often sexualized, is often in reinforcing some sort of like objectification of the body, which I think actually only ends up hurting all of us in the end.
Yeah. I mean, in the interest of time, I think that as we kind of close, I think what's interesting about both of the themes of both of what you're saying is, first of all, I think there's like a examination of what's driving us, our goals, and a consideration of the life and the possibilities that are ahead of us. And that goes back to some of the things that you were talking about with positive stories and people that are embracing these different processes that happen with our bodies. And then also the other theme that is emerging is like, we need to take this seriously. Like you are posting, here are the dangers. This isn't a casual thing. And one of the things that's happening with our society is it's being made casual. And so there's the consideration of narratives, there's taking it seriously. And then there's also transparency, which I think is an interesting thing as we consider navigating the social world, as a kind of a closing topic, because you've talked about how you think it's important that people are transparent about their plastic surgeries, the images that we're seeing online, and, the altered effects of the images that we're seeing online as well. Mm-hmm. I think it's interesting, like, a couple of weeks ago, you mentioned Kylie Jenner. So she went online and she responded to a TikTok comment where people were commenting on her breasts, like, oh my God, they look so natural and blah, blah, blah. So then she commented back the exact measurements, the procedure, and like what was actually done. Mm. And so if we are considering the future, how do we be transparent about what's going on, what we're feeling, what we're doing, in a way that is healthy, but not encouraging people to do things with their body that they don't necessarily need to do or want to do. Mm-hmm.
I don't know. I don't think there's a great way to, to necessarily do that. I think, like if you're going to reveal what you had done, of course, there's going to be people who look at that and then want to do the same thing. I think, she could have maybe added some information on like, but remember, this is invasive plastic surgery and it has real risk or something like that, as opposed to maybe just saying like the size and the surgeon. So there's a way to kind of balance that discussion a little bit more. But yeah, I mean, there's always going to be potential if you put it out there that, yeah, you in fact had this procedure, that some people are going to be influenced to go and do the same thing. I don't think you can get away from that completely. But then, yeah, on the flip side, if you're not talking about it and you're not potentially being honest with people, where they're speculating you may have had some procedure, but you're not open about it, like that could have its own problems. I think, because then it sets like unrealistic beauty standards that people feel like they cannot attain, even though they potentially can. And I think a lot of that is done honestly for people to, again, going back to the whole South Korea thing, but we have it all around the world, for people to stand out. I think celebrities, they either, whether it's through their agents or just themselves, I mean, part of what makes them a celebrity is that they're sort of different from the rest. If they were just like one of us, then why would they be a celebrity? And physical appearance for many celebrities is part of the image. It's not just their acting skills or, I don't know, their charisma. A lot of times the physical is very much a part of that image, and some will look to enhance it or adjust it, or and then I think not talking about it completely is also not the healthiest. So I don't know. I don't think there's a great way, but I think in general, more openness, I think, is a good thing. I think people like understanding that, okay, this look was achieved through some sort of manipulation rather than just like they were just born so much better than us or, something. I think it's empowering to think for people to understand that if something bothers them so much, if they have, some sort of appearance that they would love to change but didn't know that it existed as an option for them, then they should know that that's a possibility, and that celebrity that they admire and look up to wasn't necessarily born that way, but was also born with their own flaws and this and that. And again, whether it's a flaw or perceived flaw is the whole other thing. But that it's attainable, I guess. But then again, if something's attainable, you run the risk of people feeling like potentially pressured to do that and to get that done when maybe they don't really need it themselves. So and then it's just a community. And I know we were talking about how there are people in our space and our professions that are maybe not as discerning or thoughtful in their approach and don't necessarily put the patient first. So it's not like we're all created equal as plastic surgeons or psychologists. And, there are a lot of differences amongst professionals. And so people need to kind of properly do their homework if they're looking for whether it's some therapy, advice, whatever, or a procedure. Like they need to do their homework and find someone who they feel like they can be safe with.
I think that it feels like the assumption that undergirds your question is that there is going to be this kind of like ongoing change that people are making to their appearance, and that we need to be transparent about that. But I wonder what it would be like if we flipped the underlying assumption that people are going to continue to use media and present themselves, but there's no change that they're making to their appearance. Could we be transparent about that as well? Like I'm really excited to age and see what it's like to be an aging body in the same way that I was so excited to see what my postpartum body did as it kind of like this, balloon of my body deflated. I hope that as I'm continuing to do media and public facing work, that I'm also transparent about not changing my image. And in a way that says to people like, this is what it looks like to age and you could do this too. Can we not also influence in that direction and communicate to people through direct communication and modeling, which are the two things we see in research kind of shape the way that messages about image and beauty get to people? Could we use the modeling and then the direct communication of it to say it's a totally acceptable thing to age in this society and have a variety of hairlines? It's acceptable to age in the society and have your body change at different stages. It's acceptable in your body as a human in your body to have wrinkles and lines and look as old as you are or older or younger. However, let's see. Like, I think I'm curious about that kind of direct communication and saying like, this is my face. This is what I look like. Yeah.
I just wanted to, have a closing thought from you too. I think this conversation is incredible. I think it's so well nuanced, and I think it's really refreshing to hear this type of dialogue and hear people go back and forth that society might see from a title standpoint of we're so different. We have this polar ends of the spectrum of society. I think what was really interesting about our first interview that we did is that you had said you enjoy, or I get enjoyment out of turning people away sometimes. And that was very shocking to hear, but also in the comments and stuff, people were surprised with that as well. So can you explain why that is, and your mentality as somebody, a closing thought on your mentality when they come into your office?
Yeah, absolutely, Matt. I really believe in trying to put the patient first always, and that sometimes means not doing their surgery and making less money. And I'm okay with that, and I think a lot of my colleagues don't necessarily feel that way. They'll just kind of try to quote unquote close just anyone who might be interested. And, part of it is definitely just looking out for the patient. And sometimes just surgery just doesn't make sense either anatomically or based on their goals, or sometimes unrealistic expectations, or they just clearly have other issues going on. And I just feel like it would just, doing surgery and putting them through that recovery will interfere with other things that they really should be focused on. And yeah, I mean, I think we need to be careful and watch out for our patients, sometimes care about their needs even more than they seem to care about their own needs.
Closing thought from you?
What's happening right now, particularly with the massive amount of access to images on social media that we're seeing all the time, is exposing us to an image-focused way of living in a way that we've never seen before. And we have opportunities here at this particular point in time to reflect on how is this shaping our evolution as a species? What is this making us think is normal? And I want us to have a vision for not just ourselves individually, but collectively for us as people, that there could be something more than the kind of the narrow story that we're handed, that for our bodies to be objects that we can use, buy, sell, consume, fragment off, discard when they age, hate, that there's actually something more for us in being human than treating ourselves and each other that way. And I think if we can pause and reflect and dig down, maybe it feels really deep for some of us to dig, you have to work really hard to get down there, to find that there's a place inside of us that wants to know that we're safe and loved, and that that's actually at the heart of so much of what we do, and that we can create communities around us where other people can feel safe and loved, and we can feel safe and loved, and not because we have to do all of these things to belong or be okay or fit in, but because we're human and we're alive, and it's amazing that we're here. It's really a miracle that any of us exist. And shouldn't that be enough? Wouldn't that be amazing if that was the way that we saw our bodies, that it's a miracle that we're here and that we get to have this experience of unfolding in life and seeing what it's like and making it safe for other people to feel into the miracle of that too.
Truly really beautiful.
Inspiring.
Yeah. Thank you, Bill, for being here today. I think it shows like people what's possible to have these types of dialogues. Consider what the road forward is going to be when we're kind of at this fork with this conversation. And so thanks so much.
Thank you. Yeah. We didn't get into it, but like if I have a moment here, I might say, I think this conversation that we're having is actually bigger than image, because people might see us as opposed in terms of discipline or ideology. And we're at a moment culturally where people don't know how to have conversations with people who they see as different than them.
I think it's very much complementary. I think ideally people would, get your services first, and then, pretty much all across the board, and then maybe require mine.